and it has to do with the least restrictive environment. And the hierarchy kind of the least restrictive environment being regular education, no aid, right? I mean, you're there on your own, there's no restrictions at all. And that goes, and then the next step is a regular education with an aide who is assigned to your child, and potentially some pull out as well, where your child, like, let's say they have a difficulty in certain classes, they can be pulled out and then go to special ed or go and get one-to-one during that time frame. And that hierarchy goes all the way down to kind of special education only. And so the idea is, put your child in the classroom that is perhaps a little bit higher than their level, so that they can grow into that, and that with support they can succeed and grow.
Yes, Amanda, we're welcoming Amanda and her blue hearts. She just wrote in and said, yes, and some schools have teachers, about you saying that they don't push them in the autism classrooms. And some teachers have belief that parents are not going to inquire about progress. That's why I just pulled him out initially, gave them 3 chances combined with infractions in diet, and I didn't have a choice.
Yeah.
You know, sometimes it's really difficult, but it is important that parents, you know, you make a plan and you do your level best to make a plan. And we have a whole playlist with Bonnie Yates, who's a special education attorney, where we've done videos for years where she talks about things that you might ask for in an IEP, that, you know, it's supposed to be individualized, but sometimes parents are like, well, I don't know. Like, I don't even know what to ask. So that playlist on our YouTube page, really good. It's called Know Your Rights with Bonnie Yates. You can go there and look. But one of the things that I always caution parents is, once you get the IEP in place, don't just assume that they're going to do the IEP. You got to check in, hold them accountable to what's in the IEP. And sometimes something happens and you have to change the IEP. So what really helped me at some point was, somebody said to me, think of this as a very fluid thing. Get as much in writing as you can, follow the plan, see if it works. And if it doesn't, be willing to change it, and be willing to go to the school and say, it's time to change it. Yeah. I don't know if it's ever going to be perfect, but I love the phrase that you say all the time, Dr. Granpeesheh. I try to live by this now, because I've heard you say it so many times. Do enough, and I'm going to get it wrong. So you tell me how you say it, but if you do good things over and over, then good things will happen. Yeah. So, you know, and I sometimes, when it's like, I don't know what to do, I go, well, let's just do good things over and over and over, and good things will happen. Yeah. Doesn't mean that we have to get it perfect. So thank you, Amanda, for writing in. We're also saying hi to Johanny, who's writing in from Philadelphia. So and Parker is with us as well. Zora wrote in at the beginning of the hour and said, what would you describe as an autism-friendly co-working space? What a question.
Wow. That's an awesome question. So I assume that, I just want to make sure I'm understanding the question. So you're talking about an adult who is, and how do you make an environment kind of friendly or appropriate to accommodate an adult who's working in this environment, right? And it's a really great question, and it's, fortunately, thank God. I mean, I just love the fact that this has now become an issue, where some of the larger companies have actually asked me, and I've done training for some of these very, very big companies like Oracle, for instance, where they have, you know, thousands of employees. And finally, their HR departments of some of these larger companies are paying attention and saying, hey, there are lots of individuals with autism who have not only should join our workforce, but they even have specific talents that we would like to benefit from. And how do we make the workplace more accommodating to them? So there's a lot of different things. And I'll just go through and kind of talk a little bit about the different things that I've suggested to some of these larger companies. First of all, every individual on the spectrum, as you all know, is different, right? So you have to make this a little bit more, there's some things that are general and then some things that are more personalized, right? For example, in general, it would be really good if there's a lot of structure in the job. So every individual will benefit from knowing exactly what is expected of them, exactly what their schedule is, exactly what their due dates are, all this kind of stuff. And in particular, it would be lovely if they could have a coach or a mentor with whom they could meet every day, every week, whatever the company can afford or offer. And that individual would be able to go through, answer any of their questions ahead of time, and also guide them and say, these are the great things that you did last week. And these are the things that you probably want to be working on next week. And let me tell you, this is not just applicable to individuals on the spectrum. If a company can provide this kind of feedback to its employees, I guarantee you all employees will love this because it's very frequent guidance and feedback and attention, right? And the thing that I think most employees don't like, and the reason that most employees leave, is because they don't get attention and nobody listens. They feel like no one's listening, no one's giving me feedback, I don't know how to improve my work, et cetera, et cetera. So providing that kind of coaching is, I think, one of the most important things. Now, in addition, it would be really important to look at the specific needs of the individual. In general, we have a lot of individuals who have sensory issues, right? They're dysregulated from a sensory perspective. So how nice would it be if there was a quiet lounge where the individual could actually leave their job, their desk, and go to this lounge, maybe put on some headphones for lunch break and relax and be able to kind of compose themselves again. So that is kind of an important thing. Secondly, if the individual has, if we're aware of or can determine the specific sensory issues they have. For example, someone is very, very sensitive to the sound of doors opening and closing, then make sure we're not putting their desk right in front of oh.
Did you lose us? We still have
Yeah,
you.
but you still have me. Great, great.
Yes, I do.
Okay, I think that's perfect. I'm going to try to keep going then. Can you still hear me?
Yep, we still can hear you.
Great. Oh,
Oh, and now we have an echo.
I think I'm on twice. There we go. So basically, it would be important. Like I remember actually we had someone working at Card who had this issue where their desk was right in front of the bathroom area, right? And it was so distracting to this individual because people kept going in and out, and the person could not focus on their own work because it was very distracting. There's a lot of things like that that we can pay attention to. I mean, this applies, Shannon, as you know, to also classrooms, right?
Yes.
And the position of the person is so important for what they attend to. And by the way, that also goes to other things like accommodations that are made in the classroom can also be made in the workspace. The individual could be given, like, you know how in the workspace, if you have back problems, they'll give you a standing desk, for instance. Well, the individual with autism could request a noise canceling headphones, or they could request that their booth be surrounded, or that they don't have fluorescent lighting right above their head, or all these types of things that are disturbing to them from a sensory perspective. So let's try to make the work environment peaceful. Let's try and welcoming, accommodate that for the individual, and then give them a coach who is going to help them organize their schedule, understand what is coming next, understand kind of, what are the expectations and when they're due, how to even make a calendar for themselves or how to read a calendar and so on. And then, of course, as with anything else, the content of their job, right? So if it requires, and most of our folks are very, very good with technology, but I find that even in a lot of work environments, people are put in positions where they really don't know their job. Like they don't know, not a lot of people don't know how to make an Excel worksheet. Or how to, move things around on an Outlook or invite people to Zoom or just basic things like that, right? and making sure that all of that information is reviewed and taught so that the person is actually in a place where they feel comfortable with what they're doing and it's rewarding, right? So all of these things, giving the individual the ability to be able to ask for what is important to them, and just making sure that the job is rewarding. I think that's what I would consider a good workplace.
I love that. I love that you said the truth, which is doing these accommodations would make it happier place for all employees.
Everyone.
And I also, one of the things that years ago when they started having Julia on Sesame Street, and we had the puppeteer
Yeah.
that plays Julia on, and she is a mom of someone who's on the spectrum. And I remember we were talking with her and we said, the most amazing thing about this is that in 30 years time, the HR directors are all going to be kids who watched Julia on Sesame Street, and it won't be
It's true.
odd or strange or weird for them to make an accommodation. They'll just be like, oh, that's what this individual needs. And I think that's what we need more than anything else, is people who are willing, in the HR departments, who are willing to listen and willing to make accommodations. We have that in some places now. I mean, obviously, look at people like Dr. Stephen Shore, who's been a
Absolutely.
college professor forever, but he attributes that to the fact that, he can't stand fluorescent lights over his head, like they make him crazy. And when he started to teach, he said, I'm going to need to wear a baseball hat while I teach.
Yep.
And,
Yep.
and it was a time when you didn't wear hats indoors. I know I'm dating myself here, but that was considered, lack
Impolite.
of respect. Yeah. And certainly a college professor would not wear a baseball hat while teaching. And his college said, is that what you need to make it work? Go for it. And look at him. He's had this illustrious career. And what would have happened if they didn't? So, I love everything that you said, but I love the idea of us all being accommodating, and putting that set of lenses on for everyone would be a better world.
Absolutely.
Amazing. Now, Christina has written in and said that my son is often sleeping an hour after taking his meds. Not always. He does take guanfacine. I'm going to say these names wrong, for ADHD. He has a combined type, and he also is on desmopressin for diabetes insipidus. Would this be something that would cause this? I'm going to be and make him tired, or is it just because he moves all the time and it's just a coincidence? What are your thoughts? There was a little bit more. Let me see if I can find it. Also trying to wean him onto a lower dose of laxatives. So far, the lower dose is working. I think that's everything.
Well, there's a lot going on here. So it's possible the medication that he's taking for the diabetes, is, if I'm not wrong, it's an antidiuretic, and it will make him a little bit weak, muscle weakness, but I'm not sure that it would make him lethargic and that he would fall asleep right away. Given that he's also on a laxative, I would want to make sure that you are having his physician just check his electrolytes pretty regularly. Perhaps you can get him on just something like Pedialyte or Gatorade and see if that helps him a little bit. It's so often people actually faint or pass out, and we think it's something really serious, and it's just an imbalance of electrolytes. So, but if he is kind of falling asleep right away, have his physician do a blood test and check and make sure that he's not low iron or his electrolytes are balanced, because none of these meds are things like sedative. They don't have a sedative effect. So that's kind of what I suggest.
Okay. Dina says, my child, 3 years old, wakes up in the middle of the night between 2 a.m. to 4:30 a.m., especially around when there is a full moon. Any suggestions?
Yeah, so of course, the first thing I would suggest is to make sure his environment remains dark, right? So sometimes if there's a full moon and if your blinds are not blackout, then he might actually, his room might become very, very light. I don't know. But I know personally, if there's light outside my room, I will wake up. I'm very sensitive to the morning sun. So uh, make sure that his room remains dark. That's one thing. And then the second thing is, I wonder, what do you do when he wakes up, right? Because a lot of times our kids get into a habit of waking up because when they wake up, they come to our room, and sometimes we are too tired to do anything about it. So we kind of let them snuggle with us for the rest of the night. Or maybe we give them a drink. All of these things encourage the child to keep waking up. It's not even that it encourages, it's actually a physiological kind of conditioning. If you wake up and you have, let's say, a drink of milk, your body is going to learn that it should wake up at that time every day, every night. So the question I have is, what do you do? And the biggest thing you could do is to really start teaching him not to come out of his bed, and not to let's say eat or drink something, but rather to just try to start going back to sleep. Perhaps there's a way that you can have something for him where he just presses a button and he listens to music, something calming, soothing, and see if you can break the habit. But you can also write in and tell us more about what has normally been done when he wakes up.
Okay.
The other thing, Shannon, that comes to my mind real quick is that a lot of people use melatonin, and melatonin has this weird cycle where it'll put you to sleep right away, but it'll actually wake you up about between 4 to 6 hours after you went to sleep. So that, let us know if you're using melatonin, because that could also be one of the things that's happening.
There we go. And I missed the part where Christina, the follow-up, Christina said, how can I get more speech therapy and OT for my son? Currently, he only gets one 30-minute session a week. It's not enough.
Yeah, no, of course. And Christina, of course, you can either ask your school district through an IEP, or you can find a provider and actually have them bill your insurance, because all of those services should be covered now.
There you go. Okay. Mariam said, thank you, Shannon and Dr. Doreen. How can I contact Dr. Doreen for Zoom consultation? Great question. Probably the best way, and tell me if I'm wrong, is if you write directly to me, and then I can farm the question where it needs to go. So anytime you guys have a question or something that you want to get to Dr. Granpeesheh, you can write to me at Shannon at autism-live.com. That's Shannon, SHANNON, at autism. You guys all know how to spell that. Then there is a hyphen, which is the dash, and then live, LIV as in Victor, E.com, for those of you listening in podcast. Now, Johanny has written in something that has me sort of stumped and bewildered. She said, our BCBA at school doesn't specialize in ABA, and she has the little scream emoji or the faceplant emoji. Excuse me. Both would apply. I'm sure that's what they have said to her, but that makes me cringe and want to run with my hair on fire. Is that even a possibility that you can be a BCBA and not be educated in ABA?
No, because BCBA stands for Board Certified Behavior Analyst, which means your education is ABA. It is possible, Johanny, that your BCBA doesn't specialize in autism, use of ABA for autism, which is almost just as ridiculous, to be honest, right? Because the biggest use of ABA is autism treatment. But there are people who are trained in ABA, but what they do is they work on things like, how do we improve employee productivity? Or there's a lot of ABA people who, for instance, work on animal studies. But ABA in general is a teaching technique. It's weird if someone works in a school district and says, hey, I don't have specialty in this, because that is mostly the reason you're there.
And schools will say things. And in fact, Parker's written in a big long thing about how much of a hassle it is at school, and how people can do things that are not that what is actually right for the individual. Like that part we're very well aware of and versed in, and you guys are too. And so I wonder if you want to say a couple of words about that, Dr. Granpeesheh, because I think a lot of us when our kids were first diagnosed, we were like, we don't know what to do. And
Yeah.
then and people were like, oh, well, don't worry, you have a meeting coming up with the school district and the school district will take care of you. I'm a former teacher who worked in public schools. And
Yeah.
I should have known better, but I was like, oh, thank goodness the school is going to come to the rescue. And
Yeah.
they would never try to screw my child out of having something that he has coming to him. That could never happen. And I swear to you, it's like the biggest disappointment in my life that I still to this day keep meeting people who actively try to make sure that our kids don't get what they need because they're afraid of
Yeah.
something. I don't know what, but it makes me full on nuts.
Totally right. And you're right. And I hate to do this because I just don't, I never want to like, I don't want to generalize, right? And I don't want to say every school, but I guess those of us who've been in the field for a really long time and parents who have adult children who've been in the world of autism for a long time, like Shannon, we have not had positive experiences with schools. Let's just start there. I mean, I guess the first time that I testified for a parent and against a school district would have been like early 1990s, like 92 or something. And it's just astonishing to me that so much effort was put into getting legal help from the school district so that they would just win that one particular case as opposed to putting that money into trying to improve their programs.
Yeah.
Now, having said that, there are some schools that have pretty good programs and they have learned. It has improved to some extent. But in general, I don't think most of us think, as Shannon said, I think we go into it thinking the school's going to help me. They're going to tell me what to do. They're going to guide me. Same thing with like our health insurance. We think I have health insurance. Someone's going to tell me what to do and they're going to pay for it. And unfortunately, in the world of autism, it's very contentious. So a lot schools will generally try to reduce the services that they provide. That's been my experience, just because it's costly. And health insurance will generally try to do the same thing because it's costly. I mean, it becomes about money rather than about what does your child need. Because the truth is that your child will benefit, whether they're 2 or 20, they're going to benefit from a one-to-one behavioral teacher, someone who is trained in ABA, who is teaching them using the techniques of ABA, whether they're teaching them speech or adaptive or academic or whatever it might be. And it doesn't matter, like I said, if they're 2 years old or 20 years old, it doesn't matter. These techniques work, period. The issue is that it is expensive. And people of whoever is responsible for paying is always going to try to say, no, your child doesn't need it. Why don't we just give them some sort of group instruction, or why don't maybe we can just like have them do it on their own, or they don't need a special aid, they don't need a one-to-one, they don't need any kind of additional related services, all that sort of stuff. So make sure that they give you a piece of paper when you go to an IEP that lists your rights, and don't ignore that paper. Read that paper because your child has a lot of rights and you have a lot of rights. You can call for an IEP, an emergency IEP. You don't have to wait for them. You can call for an IEP anytime you want. You have the right to record the IEP so that you can use that information later on. You have so many different rights, and the more you know about it, the more you can help your child receive the services they are due.
Yeah. And somebody wrote back in and said we didn't really address the swimming question about, the child likes to swim,
Oh,
can the
right.
school pay for it? And, here's the thing is that there is no definitive, your child can get these services because it's supposed to be individualized. So I'm of the mindset, ask, because sometimes a school district will say, why, yes, we do have a swimming program and we will pay for that. A lot of times they'll say we don't have that program, but sometimes they'll pay for it if you can find it in a different place, if you can prove that it's something that's good for your child. This is why I always advocate that people find 2 support groups that are online, not that you have to go to physically, because that's just too hard, especially right now, but 2 support groups, one that's local, right in they'll tell you like who's the good dentist, who's the place to go get your hair cut, right? You can ask people, what have you guys gotten on your IEPs, right? But then I always advocate for getting one that's a little bit more global, so you can get specific about, my child does this. Has anybody else seen this? And how did you get swimming from your school? And sometimes they'll give you ideas that may or may not work in your district, but knowledge is power. And we have to band together on this. Yeah.
There are schools, as you said, like something like swimming is very simple. If the school has, let's say, a swimming program, as Shannon said, then they have to offer it to your child as well, and they have to produce accommodations if necessary. If they don't have a swimming program, you can still request it if you can prove that the swimming is something that is necessary for him. For instance, an OT could say he needs swimming every day in order to regulate his body. And in that case, they would have to pay a swim instructor and him to go to a swimming place in order to get that service.
Yeah, it's amazing what people have accomplished. I want to switch though to our friend Paula, who wrote in and said, "Hi ladies, my 17-year-old ASD son with anxiety struggles with socializing. He has a learning disability, which adds to his struggles in trying to make sense of situations. I'm trying to get him out and about a bit by bit, trying to build his confidence. Social clubs are really difficult, and he doesn't enjoy it. He's constantly on edge. People are saying that I should make him go. How do I make him go to a situation that he finds so difficult? What are your thoughts on this?" And she sends X's.
Yeah. Thank you. That's a great question, Paula. Let me give you some additional suggestions that might work. I don't know. First of all, I would always, when I hear that someone has anxiety, I want to focus on that for a minute. We tend to ignore anxiety and depression when they're not extremely severe, and we shouldn't do that. We should deal with them at whatever level they're at before they get severe. So when you say he has anxiety, then my question becomes, and I don't know his functioning level, but are you doing anything about that? Because there's a lot to be done. You can have medications that help with anxiety. You can alter his diet. You can have him talk to a therapist and who would work with him and do cognitive behavioral therapy type of activities. Let's help him overcome his anxiety. So that's number one on its own. Now the issue of social. So it's funny because we often think that our kids should, like, we just throw them into a social environment, any child, typically developing even, and, they'll be fine and they'll start socializing. So let me tell you, if I personally was taken to a social environment where there's a lot of people there and they're all chatting and so on, I would last maybe 5 minutes. I'm not someone who can handle just a social group. Okay. That's not the way I socialize. People socialize in different ways. So first of all, find out what is his interest. What are his areas of strength? If you see a group of kids socializing in a robotics group, that is completely different than a group of kids socializing in a dance group. So we have to find out what he's into. And then whatever that is, let's strengthen that alone. Don't worry about other people first. Let's strengthen that. Let's get him into that so that he enjoys that activity. Then find a club or even just one other person who's also interested in that activity. And that's how you start the social activity. The activity has to be of interest, especially when you're talking about, teens or the teenage years are difficult to begin with. So that's how I suggest you do it. Don't worry about trying to force him to go to some social activity that already exists. Find one that has his niche in it.
I super, super love that advice. Now, Dina wrote back in, she's the one that had the child who was getting up in the middle of the night.
Yeah,
And she said, and you asked some questions. So she sent some answers. He is wide awake and stays with dad and me and gets up to eat and drink. Yes.
yeah.
She also says he's already on melatonin. And many people wrote in, and I am amazed how many people wrote in and said that parasites during full moon cycles get more prevalent.
That's
Um,
interesting.
it's very interesting.
Yeah, and I'll have to read up on that. But what I want to say about this child then particularly is you got to change all of those habits, like all of that. He should not be coming in and staying with you and dad. He should not be getting food and so on when he wakes up in the middle of the night. And it's going to be tough. And because he's on melatonin, melatonin has this cycle that will wake you. So either you need to talk to his physician and increase his melatonin dose, or the physician can also give you something like Benadryl on a very low dose that you take with the melatonin, and then he will sleep through. There's also now even time release types of melatonin. So you want to talk to his physician about that. But in terms of how you manage it when he wakes up, it's going to be tough. I won't lie. There's going to be a few nights of no sleep, but it's important that you stay in he stays in his room, and you can stay with him initially, but you will eventually have to fade yourself out, and he stays in his bed. And then there will be no real motivation or reinforcement for waking up. The moon thing, I will definitely look into this whole concept of parasites and how they would interact with the moon cycle. But again, at least initially, make sure that his room remains dark.
Yeah. This is one of those things. It's super hard and it takes a while because changing sleep cycles change. But I can remember when my son was 6 weeks old, and everybody had said to me while I was pregnant, the baby that is in your belly is the baby that comes out. So if you're up at 2 o'clock in the morning, don't be surprised when you're pregnant. Don't be surprised if your baby is up at 2 o'clock in the morning. I just couldn't do the math on that while I was pregnant. I don't know why. And then the baby came out, and then I understood the equation instantly.
Yep.
But then I remember going at 6 weeks to the doctor's office for the 6-week checkup, and he gave me exactly this advice, Dr. Granpeesheh. He said, the way that you get a baby to sleep through the night is that when he wakes up, there is no party. You make it as dull as it can possibly be.
Yeah.
If you're snuggling and rocking, then he's going to make sure that he wakes up for that. And that child just becomes an older child, becomes an adult.
Yep.
And if fun things are happening in the middle of the night, we would all wake up and party.
Right.
Because that's the good time. Mom is not on the phone. Dad is not running around to get out the door. Mom is not feeding the dogs. They have their undivided attention. It is everything that they want. If you think about it from that lens, it makes total sense. And Amanda says, yes, we definitely don't feed them.
And also the other thing is it also makes sense that we kind of try to avoid dealing with it because we're exhausted.
Oh.
We don't want to start a whole thing at night. I just want to get my sleep. So I'll let him come in and sleep here as well. And believe me, the sooner you deal with it, the better, because it maybe now it's not a problem. When they're 18, it's a problem, or even sometime between now and then. A lot of times parents will come to me and say, well, we haven't slept in the same bed for years because our child who's getting older sleeps with mom or dad, and the other parent now sleeps in the child's room. So, try not to let it get to that point. It's something our kids do learn to sleep in their own bed.
Yeah, it takes time though. Be patient with yourself. Paula wrote back to us and said that our teen with anxiety that doesn't like the socialization, she said, thank you so much. He takes 20 milligrams of fluoxetine daily, only dose he can tolerate. His special interests are tumble dryers and road traffic signals, not your everyday interests. I sort of love that. And I'm wondering who else also is interested in that, but it's very specific.
Yeah, absolutely. And fluoxetine is an anti-anxiety medication, which is antidepressant medication, which is great, very good. And tumble dryers and road traffic signs, you have to find things that might be similar to that. Like, for instance, because he's interested in road traffic signs, I wonder if he's interested in stamp collecting. I don't know, but there are clubs that are, like, offer him things, look around and see what types of clubs are out there, then offer him all those different ones and see if he gains interest.
And because that's mechanical, and because you brought up robotics before, I have to say, for those of you who don't know, there's something called FIRST Robotics that, and when kids are younger, there's Lego Robotics, Mindstorm. A lot of schools are affiliated, and a lot of if you Google it, you'll find one that's close to you, and they are international. And they give away millions of dollars worth of scholarships every year for kids who are interested in that kind of thing. But in the meantime, there are clubs where it's like-minded kids and they teach them how to put together a robot to achieve a certain task. Now, it might be that, he has to go in and see that, if you do this, you can make the tumbler tumble like the dryer. But I used to say all the time, where are all the kids who are doing better, that did therapies, and where do they all go? Like, why don't I see them, Dr. Granpeesheh? Where are they? And then I went to the first robotics tournament with my son when he was in high school, and I remember texting you from it saying, I found them. They're all,
Yeah.
and it was a stadium, you guys, filled with parents like you with their teenage kids. And it's not just teenagers. They start at age 4 with very basic tasks with Legos. And usually these programs are totally free. So I encourage you, go to First Robotics, Google it, and see the different age groups. It's sponsored by NASA, for heaven's sake. So anyway, something to look at. And there are all different kinds of things that happen in robotics. So if your kid is like, my son liked maintaining the machinery. He got more into that than anything else. But there are other kids who got into the marketing of the robot, and there are kids who got into the programming, and kids who got into the building, and kids who got into
design, and
there's so many different aspects to it, and it's a team of people. So for us, it was the sports activity that my son engaged in, and there are competitions, and you go to the competitions, and they win. Oh my gosh, it was more fun than you could shake a stick at. And you travel. If that's we went to Las Vegas, and it's like a 3-day tournament that my husband and I went with our son. We will never, ever forget it. It's so much fun. So I encourage you guys to check that out. And they love our kids because our kids tend to be good at this. So just as a possibility to try, they even sell those Mindstorm robots so that you can do it at home first. They're a little expensive. Try to find one that's used. In any case, I'll move on. Kahinde says, my son is always agitating and restless, 21 years old, and he has to be on Risperidol treatment, 6 years now. Please, what will do? I want to stop the tablet. Advice, please.
Yeah. So I'll answer that. And then, Shannon, I don't want us to forget, Paula had written in a question a little bit. Was it Paula or no? I saw Ellen. Ellen had written about her ASD twins. So I don't want to miss that either. But yes, Risperdal is not going to necessarily, I mean, I don't know that that is the medication that you should be concerned about right now. I think that if he is always restless, you should be looking at maybe guanfacine or another type of medication for ADHD. So I would actually go back and get an evaluation. So, and I don't know what country you're in, but a lot of times, because in the US, for instance, Risperdal is one of the very, very, very few medications that have been approved for autism, and so a physician who's not an expert will just give you Risperdal, and it basically is not really dealing with much. It's just kind of like making your child, it's an antipsychotic medication. So it's basically going to just numb all responses. It's going to reduce all responses. But if it's agitation and restlessness, you might be looking at hyperactivity. And then you have a whole array of other medications that could help, which really you should evaluate and consider. The other thing is, let's not forget that the most effective treatment for any kind of ADHD as well is to be in a program that is behavioral and that keeps you very occupied and focused. So I don't know how he's spending his time, but it would be very good if he had a structured educational program where someone is working with him and keeping him kind of organized, structured, busy, learning things that are very useful to him throughout the day. And that really will probably help with the agitation as more than anything.
There we go. I'm so glad you brought up Ellen's question, because Ellen, I totally missed it. But here we are. My ASD twins are 22 and need to start work programs. They both live in residential facilities. My son's regional center social worker is on top of it, but my daughter's is lagging even when I call or email her weekly. Should I ask to speak to her supervisor? I don't want my daughter just sitting at home all day. Oh my gosh,
Absolutely.
loving this mom so much.
Absolutely do it. And you're fortunate to be in a situation where you actually have someone to compare to. And so, yes, I would absolutely speak to her supervisor. I assume they're in different residential facilities, one for girls, one for boys, and that you don't have access to the same social worker who's working on your son's case. But yeah, don't hesitate. It's really, really important. And honestly, there's a wide variety of people out there. So always insist on what you feel is right. Listen to your intuition. As I say this to parents across the board, no matter what you're doing, whether it's ABA, speech, OT, residential supervisor, school teacher, school, whatever it is, listen to your intuition, because no one's paying attention to your child's particular responses as much as you are. So if things are not going well, if you have a bad feeling about it, don't let it go. Keep poking, keep prodding, keep figuring out what's going on until you get your child into a place and or a treatment facility that you feel is appropriate.
Amen, Dr. Granpeesheh. Let's slip in from Abigail. Dr. Doreen, I have a question. My son is 4 years old and has a half day of school, ABA at school 1-to-1, and then has ABA at home for 5.5 hours. This next year, the school would give us a full day in the fall for preschool, but I don't know that would be a benefit more. What would be more beneficial, full day of school or a half of school and half at home with ABA? What would you suggest? P.S. Next fall, 2023, he'd start kindergarten.
I think I like the half and half more. And I'll kind of tell you why. I mean, first, two reasons. One is that I never want to really put my eggs all in one basket. Like, I don't know, like, what if, the staff at school change and then you don't have good people anymore and now it's your child's entire day or whatever it is. And the people at school are going to be very academic focused. And that's not all we want, right? We want our kids to learn a whole variety of things that have to do with adaptive functioning, like, hygiene and how to take care of himself at home, how to get dressed, how to socialize, how to go to the mall, how to, buy something, a million different things. So I think I like the idea of half and half better, because you'll be able to get a lot of those things from your outside ABA provider. And then the combination and please make sure, of course, that you have at least once a month a meeting where everyone attends, everyone, or at very minimum, the supervisors of both teams. Because you really, when you have two programs running, you really, really want to make sure there's consistency. And that's a big problem because sometimes one environment will accept things that are already mastered in the other one. So they're kind of wasting time. Everyone needs to be on the same page and pushing at the same level, using similar levels of reinforcers. And the goals all have to kind of be shared. So make sure you do that. And then I would probably keep two programs rather than one.
And I love that advice and agree with it. And can I say one of the reasons why, in addition to everything else that you've said, is that, I look at my son who sometimes has a hard time making a decision. Like, I'll say, do you want to do this? And sometimes that's the hardest thing for him because he's like, oh, but if I do this, then I don't get that. And
Yeah.
what I try to do for him sometimes is to say definitively, well, you have a choice between going to the movies or seeing your friend who's in from out of town. And here's the thing, for the movie thing, we can always go to the movie tomorrow. The friend who's in from out of town, you can only do right now. And that makes it easier because it's like, oh, well, there's, this thing I can always do. And this other thing, I have a limited opportunity to do it. And that doing ABA intensively at home is a limited opportunity. Like I know so many parents who their child goes 6 and they go, oh, I should have done that. I'd like to do it now. And good luck. Like that's a hard climb. It's not impossible, but it's a hard climb. Whereas school's going to be available. And preschool is like, I love preschool. I'm very fond of preschool. I think it's good to have some hours where they can apply the things, as Dr. Granpeesheh was saying. But that opportunity to do the ABA intensively and get that one-on-one focused while their brains are still so, open to so many things, you're not going to get that opportunity again.
It's true. And also, Shannon, I don't know of any schools that do pure ABA. Like they're using ABA techniques in the classroom. That's not the same as doing the one-to-one intensive that Shannon is talking about. And the other thing you just made me realize, Shannon, is that God forbid one day one of your sources stops funding it. You want to have the other source. So make sure you have both. You're using your private ABA through health insurance and then your school district so that you continue to have both.
And I feel like enough people don't know that your ABA, your intensive ABA and the funding for that, it's a limited time. And as much as
it's supposed to be, I mean, legally, it's not supposed to be, right? Legally, no, states don't have the right to cut you off based on your child's age. But they do. As Shannon said, the intensive stuff cuts off. I mean, it becomes extremely difficult to get intensive therapies funded after, let's say, age 8, right? Because the research, unfortunately, always focused on younger children. So a lot of health insurance providers will look at the research and say, there's not enough research to show that adults benefit from ABA. There's tons, but not intensive. So they'll fund some hours, but really, as Shannon said, the intensive stuff becomes harder and harder to get as your child gets older.
And we are like almost out of time here. So I'm just going to say, Amanda wrote in and said, I watched an old episode from 9 years ago of Ask Dr. Doreen and heard one of my questions that Dr. Doreen answered. My son turned 14 yesterday. That's how long you guys have been helping me. Thank you, with her blue hearts. That's amazing. Happy birthday to your son. I'm also sending a big hug to I Am One. And that we love you, and hopefully you will learn over time that you're amazing exactly the way you are. And we didn't get to everybody's questions. I apologize, but we do the best that we can. Dr. Granpeesheh, we love you.
Thank you, Shannon, so much. And I just saw I Am One's messages, and I want to ask you to please come on our show again and keep asking your questions and talk to us, because we will be part of that tribe for you as well. And we will help you get through the stuff that the struggles that you're going through right now. I completely understand what you're saying. It is not unusual to feel alone. even though you have a group of people around you who are also on the spectrum. But keep coming back to this show. We talk to a lot of folks on this show who have the diagnosis of autism. And I want to make sure we provide you the support that you need right now.
There we go. That's why she is who she is, Dr. Doreen, right? But we appreciate all of you guys. Hey, tomorrow on the show, we have an amazing accountant who is himself someone he identifies as being on the spectrum, and he's helping a lot of teens and adults to learn how to handle their money and what to do with their money in a way that speaks to those on the spectrum. So I am one. Come be a part of that conversation as well. We're really looking forward to having him with us. We're going to take on those money issues. And this is great. By the way, he likes to deal with teenagers and adults, but he says that what he teaches is very effective. If you have a 3-year-old, they're going to be 13 at some point. So in any case, come and join us tomorrow. We'll be back then. Until then, give your kiddos a hug from me and one for you too. Thank you, Dr. Granpeesheh. Bye-bye for now.
See you soon.
If you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and on Instagram for important updates. And please download our free podcast wherever you get your podcasts. Thank you so much. See you next time.